Dr. Dennis Norem from Mercy Health, who's been with us every step of the way through this coronavirus pandemic and continues to be at our side as we continue to slug it out. Dr. Norem, good morning to you.
Good morning to you guys.
How's everything going with you this morning?
Oh, it's going well. A little gray out there and foggy, but what the heck?
Yeah, what the heck? It's Monday. We're supposed to expect this sort of behavior on a Monday. Some of the stuff making news as far as COVID goes. We had the Surgeon General yesterday talking about the number of novel coronavirus cases nationwide, deeply concerning, adding more kids are being hospitalized in the U.S. with COVID-19 than at any other time during the pandemic. And more than 151,000 new COVID-19 cases have been reported in the U.S. each day. That's up over 1,000% from June, according to the CDC.
Yeah, that's quite a concern. And I see in Illinois, we reported Friday 4,900 cases, the highest since January. So we are maybe better off than a few states, but obviously we're having the same issue with very high numbers.
Are we having the same issue, high numbers with the children getting infected?
Yes. I don't have a breakdown, but yes, the Delta variant has hit the kids, I think, much harder than the original variant did, which is not surprising. It's more contagious, and as we saw with the kids, were kind of at the end of the line. The more susceptible people were hit with the original variant, but now we're seeing everybody being exposed and becoming ill.
Dr. Murthy says more than 1 million people have been vaccinated each day over the past 3 days in the U.S., which he called encouraging.
Absolutely. We've talked about vaccinations, and really that's our only way out of this mess.
We hear a lot about vaccine efficiency. I've heard words like waning, and it's not working as well. Where are we with the vaccine and the booster? Is the original one that we were taking a couple months ago still going to be effective here in the next couple months, weeks?
Well, it appears that it's still effective, but clearly the immunity does wane. And as we've discussed, the Delta variant is a little more resistant to the vaccines. And that's why there's this whole discussion about boosters. We talked a little bit about it last week. The FDA talked about the fact that immune-compromised people will need a third shot, and they kind of couched that saying that's not really a booster, the idea being that immune-compromised people need probably 3 shots to maintain the same level of immunity that a normal person would need only 2 shots. Having said that, then the rest of us, with our immunity waning over a period of 6 to 8 months, they're probably going to recommend, and I think it's pretty clear that we are heading this direction, that at 8 months, all of us will be recommended to have that third shot, which will be a booster.
Do you think that announcement's coming soon, that regardless if you're immunocompromised or not, that third booster or second, if you did JJ, after 8 months, is that announcement coming sooner than later?
I think that's coming very soon for the messenger RNA, Moderna and Pfizer. The J&J thing is up in the air. There's no recommendation that I see quite yet with that. I think they're going to need some more data. And I think what we've seen in Israel is really eye-opening. They're already in the process of giving the third shot to everyone over the age of 60, and they found that the immunity is 5 to 6 times more protective against hospitalization and death with that third shot. So they've even dropped the age now to 40 for everyone for a third Moderna or Pfizer immunization.
Yeah, according to what I'm looking at here, the plan to roll out COVID-19 vaccine booster shots to Americans beginning the week of September 20th, pending FDA review. Shots would be offered to individuals whose second dose of a COVID vaccine was 8 months ago. CDC Director Dr. Walensky cited several studies indicating waning protection against infection over time. A study out of New York from May to July saw vaccine efficacy against COVID-19 diagnosis slide from 92 to 80%. And a preprint from Mayo Clinic saw Pfizer's vaccine efficacy against infection plummet from 76 to 42% in the face of the Delta variant, with Moderna's efficacy decreasing 86 to 76.
I think that's a good summary of the data. And again, if we look across to see what Israel has done, I think that clearly cements down the idea that we need to do this. And I believe for people who are immune compromised, which is about 3% of our population, the recommendation is going to be a third shot 28 days after their second shot. So anybody that's unvaccinated is going to get a series of 3 right off the bat.
You get a series of 3 right off the bat.
Okay.
Riles mentioned the FDA approval in there. I know that's holding a lot of people back from maybe getting the initial vaccine. Are they coming around to approving these, at least 2 of the original vaccines, to maybe assuage those fears?
Well, I hope so. It appears that the Pfizer will be approved, some people say, as early as today.
Right.
And Moderna should be right around the corner within a week or 2. That will allow much more leverage in terms of requiring the vaccine, and it also will allow a little more follow-up. I believe for the emergency use vaccines, they only did a 2-month reporting period for side effects, which was the requirement initially. With an approved vaccine, they're required to follow them for at least 6 months. So I think that will give us a little more safety data and maybe reassure people a little more about the safety of these vaccines.
I was going to say, is this a move basically to try to thwart vaccine hesitancy as much as we can?
Well, I think so, but it is part of the normal process of approving any type of vaccine or, I guess, treatment under emergency use, that at some point it needs to become fully approved, and it changes some of the follow-up and safety data. But clearly there's a push to get people vaccinated, and this will certainly help a number of people. Hopefully it'll take away their hesitancy. If not, it'll force them to decide, are they going to continue to come to work?
When we talk about vaccines, there's basically 4 out there, right? Pfizer, Moderna, the J&J, and the AstraZeneca. We didn't get the AstraZeneca over here, and it sounds like we have 2 vaccines that are working very well that people approve and trust, and that would be Moderna and Pfizer. Then we have the J&J, which it's not the same. The hesitance or the efficacy seems to be lower. I'll be honest. I'm a J&J shot guy. That was the only one that was available when I went to go get my vaccine. Should I be concerned that my J&J seems to be lagging behind the other vaccines? And if that booster comes around, should I be hunting out one of the other 2?
Good questions, and I don't have a good answer to. I think you would expect that the J&J, the immunity is waning just like the other 2, and I'm kind of waiting to see. We haven't heard much from the FDA as to what we're going to do with the J&J. Are we going to cross over and possibly recommend one of the others for a booster? That hasn't been clearly yet, and I haven't seen anything pop up on where we're going with that. So I think that's a question yet to be answered.
And just to follow up, am I wrong in that perception of what I have of what at least how the vaccines are being talked about, that the J&J is just not as well liked by everybody in the community?
Well, I think it clearly was not quite as effective, but in the big picture of vaccines, it still was very effective. Excuse me. When you compare it to other vaccines in the past, the flu vaccines, for instance, and initially, it wasn't quite as good as the messenger RNAs, but it was still in that 70-80% range. Having said that, again, it isn't quite as good, and the concern is now, what do we do for people like yourself? Because we have to assume that the immunity is waning a bit. Mm-hmm. Do we give a booster of J&J? Do we give a booster of a messenger RNA vaccine? Don't have a good answer to that yet, and that's something we're going to have to watch to see what the FDA recommends.
Okay. And speaking of boosters, looking down the road, is the COVID booster something that is going to become as part and parcel to people's lives as getting a flu shot each and every year? Is this something that you could see that we could have this discussion in 10 years?
We certainly could. It really depends on how the variants become a problem down the road. And we just don't know yet. we know with flu, the flu virus has the ability to mutate very rapidly, very commonly. So we see different strains popping up all the time, and we see this constant turnover with the vaccine because of the new strains. We don't yet have a handle, I think, on the COVID virus to know how quickly and how often is it going to mutate, and how much of a problem is that going to create for our vaccine immunity. So I think that remains to be seen. I think initially it's not surprising that we are seeing some waning of our immune system and needing the booster, but whether it's going to be a yearly booster, every 2 years, every 3 years, I don't think anybody knows yet. The virus is going to probably tell us.
Well, I wish it would get started.
Right. Get going.
Well, I agree with you. We'll know a lot more a couple of years down the road when we see where this all plays out. But it's certainly a learning experience.
Delta variant causing tons of problems right now. Is there a Theta variant, a Gamma variant, some other Greek letter that I don't...
Is there a Lambda out there?
Yeah, well, there was a Lambda, actually, that was causing a little bit of problems. But is there another variant that we've been spotting elsewhere around the world, maybe, that could be next in our headache with COVID?
Well, it could be. I think one of the reasons it hasn't been is that the Delta variant has kind of beat it out.
Okay.
It seems to be by far the most contagious of any of the variants. So those other variants like Lambda, which has been around longer than Delta, really hasn't gotten a foothold anywhere. So again, it remains to be seen. The other thing that we have to remember is the Delta variant is more contagious, and we're having a little, problem with waning of our immunity. As we continue down the road, will the fact that we're exposed to the Delta variant, will that increase our immunity against some of these other variants? We just don't know. So we just have to watch and see how these other variants, if they even become a problem.
But that would be optimum, wouldn't it? The more exposure, the more all of a sudden that helps us with our immunity, and our immunity then to other variants.
Yeah, and that hopefully will happen, as we've kind of seen that with the flu. As we're exposed to more flu, and again, the flu is much more likely to mutate. We see many, many more variants. We know that the flu virus, just by its structure, is more likely to mutate than the COVID virus. But we kind of see things come back in circles. We see variants of the flu that are similar to variants we saw 10, 15, 20 years ago. So we may see something similar with COVID. We just don't know yet.
All right.
Yep. Once again, another week where a lot of question marks are floating around on the horizon, but we've dealt with a lot of weeks like that. But luckily, we got Dr. Norem here to clear up some of this stuff for us. Doctor, as always, we appreciate the expertise. We appreciate the time, and we'd love to get together and do this all over again next week.
We're going to be here, guys, I'm sure.
We'll appreciate it. Thank you, Dr. Norem. That's Dr. Dennis Norem with Mercy Health.